Good morning, good afternoon, good evening. I'm Dr. Alvin Marcelo to talk to you about standards for terminology and coding. My talk will cover clinical terminology, coding, and classification, their relationships, and some next steps for clinicians like you. As humans, we interact with our world and assign names and labels to things around us. Some may be concrete, while others may be abstract. At any rate, these ideas or concepts are assigned words or names or terms. We have two examples here. On the left, we have the concepts, and on the right, the terms that describe them. A green circle and a blue car. We use terminology to describe almost everything in our experience. The level of detail humans use for expressing their thoughts is limitless. At some point, we need to start counting and aggregating ideas and concepts so we can have a better understanding of patterns in the world. What is the most common infection among Asians? What treatment works best for breast cancer? In order to do this, we start classifying these ideas and concepts into groups, and then we assign a code to each group. The International Classification of Diseases, developed and maintained by the World Health Organization, aims to standardize the groupings of diseases across countries so that their data can be comparable. The ICD-10 code G20, for example, is for Parkinson's disease. This is the WHO's online ICD-10 browser, where you can search for different codes and see how diseases are classified. While this table summarizes codes, classifications, terminology, and nomenclature. So when do you use terminology and when do you use code? The answer is it depends. If you are a clinician taking care of a patient, you should use detailed terminology to describe the condition of your patient. You will use words that are very specific for that particular patient in front of you. The next patient, though similar, may have a different set of terms since no two patients are exactly the same. Even twins have differences. But if you are a coder, you look at the terms used by the clinician and then using a formal process, assign a code to those patients. So while patient A may have a submandibular cancer and patient B has a submaxillary neoplasm, they both are coded C09. You use terminology to describe the clinical picture of a patient, and you use code to generalize a case into a classification for planning and administrative purposes, often for public health. What is important is the sequence. For you to remember that you should never code off the bat. You should first do detailed clinical documentation with terminology and then select a code for that particular case. The reason is obvious. If you code immediately, you will lose information. Let me give you a simple example. Coding before clinical documentation can cause loss of information. The details describing this car as a blue Ford Mustang 1978 coupe will disappear. It is immediately coded as a car. So be careful. Never code off the bat. You should first do detailed clinical documentation using terminology and then later do coding. In closing, for all of these terminologies, codes and classifications, there are already international standards that can be used. If we use these standards, then there will be better comparability of our data with other countries. So let's use standards as much as we can. Thank you.